that hurt at all? Any discomfort there?
About right there.
Right there. Okay, so mild inflammation here. Maybe a mild delay there. So we check for consensual response. We do have appropriate constriction and dilation. 91, 100, 11.
Right. Both. Right. Left. Front of my head. On the right.
Do you hear a sound here?
Yes.
Tell me when it stops.
No.
So that was good. Feel vibration here?
No.
Okay, gentle cleaning of the external ear. All right, Cami, so I'm just going to get that updated for you. So as we were discussing, I do have the results of your examination, and there was some abnormality at the inner ear. It looks like there was a little bit of damage done to the tympanic membrane. So when you had your test at the otolaryngologist or the ear doctor, he did tell me that there was some deficit, especially of the right ear, it looks like.
Yes.
So it looks like that was where most of the injury was located.
Yes.
Okay, so I just want to see if he made any notes here. Okay, so there is some specifics. He wants us to retest a couple of things since it's been about 2 weeks now. Have you been using the ear drops? You have?
Yes.
Yeah, okay. And no like increased discharge or anything with that? All of that was fine?
Nothing crazy.
Okay, so it looks like we have inner ear, mild tearing of the tympanic membrane, not going to require surgery. So I'm just going to mark that I have discussed those results with you, and then we're going to go ahead and perform the retest now. So he wants us to test high, low. Okay, all right. So he wants us to test a couple different things. So we will go ahead and do that now. And I'm going to start by just making sure that there's no other cranial deficits going on, of course, before we test for that hearing. So as with your previous examination, I'm going to test the pupillary constriction and dilation. So this just helps make sure that everything is still working appropriately after your accident, okay?
Awesome.
So I'm going to have you look straight ahead at that point just there on the wall. I know it's kind of hard to spot. I'm going to shine this in your eyes. Any sensitivity to light recently?
Not really, no.
No. Okay. No increased pressure or anything behind the eyes?
A little bit, but only when I am turning my head.
Okay, so when you're kind of putting pressure on the area just a little bit.
Yeah,
That does
feel
make
it
sense
kind
with the rotation. So when I do your hearing test, I might have you try positional and see if it makes a difference. Okay, so if you look straight ahead for me, I don't want you to follow the light just yet. Just keep your eyes fixated. So I'm going to start here on this side. Just checking for that first independent response, which I do think that looks okay. I don't, maybe a mild delay there. So we check for consensual response. We do have appropriate constriction and dilation. Okay, so I just want to occlude one side here. So I want you to tell me if just the pressure behind your eye increases at all with this here versus on this side. Does that feel about the same?
No.
It doesn't. Okay, so I am seeing a little bit just of a delay here on this side. Okay. So I'm going to have you follow the light now, Cami. So I'm going to move it just like this. I'm going to hold your head, just keep your head still, and we're just going to follow with your eyes. I want you to tell me if it causes any increase in that pressure on this side versus this side.
Yeah, a little bit, yeah.
Okay. And if we go up, does that feel okay?
Everything feels fine there.
And if I go around, does that increase pressure at all? Versus if I go this way?
No, not really.
That does, okay. And if I come just out, and then all the way in, any pressure there?
A little bit,
A
but
little.
nothing uncomfortable.
Okay, all right. So I think I'm going to palpate around. I just want to feel if there's any kind of pain or any areas of tenderness. So as I palpate just directly along the brow bone, does that hurt at all? Any discomfort there?
About right there.
Right there. Okay, so mild inflammation here. And if I come down around towards the ear, I'm going to have you just turn slightly here. Any increased pressure here?
I feel it behind my
Do
ear.
you? Okay. So definitely some here. I actually do feel just a little bit of warmth there still. So I know the ear drops he gave you are prescribed for about another 2 weeks. So definitely want to continue regular use of those. Don't stop them early, even if you start to feel, you know, a little bit better. We want to make sure that you keep using them. And does that still feel down here by the clavicle, or has that improved at all?
It's improved.
It's improved. Okay, good. Very good. Okay. So let's go ahead and perform those retests that Dr. Swine was talking about. So I'm going to use, he wants us to test at a couple different hearing levels. So I'm going to start with my gloves, because these tend to produce just a very soft sound. Yeah. All right. Okay. So can you hear this on both sides?
Yes.
You can. Okay. So I'm going to have you close your eyes for me, Cami, if you're comfortable. I'm going to produce a sound. Now to start with, I'd like you to indicate whether or not you hear it on the left or on the right side, or both.
Okay.
Okay.
Left. Right. Both. Right. Left. Behind. Down in front.
Very good.
Both. Right. Right.
Good. All right, so now I'm going to kind of trail the sound off. It's going to get very, very quiet. I want you to try to tell me when you no longer hear it, okay? So you should hear it pretty prominently here.
Yes.
Tell me when you no longer hear it.
Now.
Good. And on this side, you hear this?
Yes.
And when you no longer hear it.
Now.
And tell me when you start to hear something.
Now.
Okay. All right. So let's test your, I'm going to increase in kind of sound. So start with this. Now this is not one that I tested on your initial visit. So just have a little pipette here. It kind of produces like an aerated sound to increase pressure. I'm going to try not to point this directly in your ear because it can still cause damage to that already kind of tender membrane. So what I'm going to do is just create this sound here. Can you hear that? So I want you to indicate to me whether or not you hear it left, right, front, back, above, or below. Okay, so close your eyes for me.
Right. Behind. Right. Above. Left.
Good. So now we're going to change positions. I want you to turn your head to the right. Same thing, just tell me where you hear it.
Left. Front of my head. On the right. Right again.
Okay, so go ahead and turn the other way for me.
I heard that behind me.
Okay.
Right side. Left side. Behind.
go ahead and turn your head midline, Cami. I'm going to perform a secondary test here. So this time I'm going to do what's known as a whisper test. So I'm going to make a bit of a sound on one side. I'm going to whisper a few words on the other side. I want you to repeat them after you hear the third word. Okay? So I'm just going to make a sound here. Book, table, stethoscope.
Book, table, stethoscope.
Good. And I'm going to have you turn your head this way, so we're increasing pressure on that tympanic membrane just below the ear at the TMJ. So again, you're going to hear 3 words. Lamp, hospital, water.
Lamp, hospital, water.
Okay, very good. So we'll return midline here. I'm going to do the same thing on this side. This time you're going to hear a series of 3 numbers. Okay. 17, 27, 77.
17, 27, 77.
Then we're going to turn your head all the way to the right. Same thing, 3 numbers. 91, 100, 11.
91, 100, and 11.
Very good. Okay, so with your sound, you actually did really well, so that was a good sign. All right, so we are going to test the specific that Dr. Swine listed. Now, he wants me to test for 128 hertz again. So this is going to be kind of a mild frequency here, so different than the one we tested last time. Can you hear that okay?
Yes.
Okay. So I'm going to test a couple different ways. The first thing I'm going to test is for bone conduction. So I'm actually just going to use... There we go. Okay, so... Do you feel vibration here, Cami?
Yes.
Good. Do you feel vibration in both ears?
No.
Do you feel it in either ear?
No.
Okay, so mild diminishment there. If we start with your unaffected side, do you feel vibration there?
Yes.
Do you hear a sound here?
Yes.
Tell me when it stops.
No.
So that was good. Feel vibration here?
No.
Feel vibration here?
Yes.
You hear a sound here?
Yes.
Tell me when it stops.
Stops.
Okay, so there was just a little bit of a delayed reactivity on that side. So we're going to test now just the sound. So I have you keep your eyes closed for me. I'm going to produce a sound. I want you to tell me when you hear it, okay?
No. 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 No.
Okay.
No. No.
Good.
No.
Still just a little bit of delay here on the right side. So I'm going to do that again. I want you to tell me if this here, if we say this is 1 and that's 2, which one is louder?
Number 2.
Okay, and on this side, let's do it like this. This is 1 and this is 2, which is louder?
Can you try again?
Of course. So this is 1, and this is 2.
Number 2.
Good. Okay. I'm just going to turn you here. I want to test a little bit further on this left side. So I'm going to produce the sound. I'm going to move your hair just a tad bit here. Just make sure we fully expose the ear there. Alright. So now that I have kind of exposed this ear a little more, we're going to test just a little bit more distinctly. So I'm going to make the sound. I want you to tell me when it stops.
Stops.
Okay.
Now. No.
Good. So I'm just going to do a little bit of vibration on the bone itself. This might feel mildly uncomfortable. I just want to stimulate that tympanic membrane and the fluids in the ear. So it does appear as if the drops he gave you are helping, but I still see just a little bit of deficit here. I do see what he was talking about. It's just not quite as reactive as your left side. Just introducing the sound to the ear. Might start to feel a little bit of increased production in your earwax. That's totally normal. It might be slightly more liquid than you're used to, and that's okay. That's just kind of your ear healing. Production of fluid is totally fine as long as you see clear and it's not, yellow or orangey or any blood tinted. That's fine. Apologize for all the helicopter sounds. We're having quite an emergency case happening downstairs at the emergency department, so there's just a little bit more activity than normal.
I understand.
So I'm just going to spray with a bit of antiseptic. And let me just turn you here slightly. Just very gentle cleaning of the external ear. In case I introduce any bacteria to the area, I don't want anything to interfere with the healing of your tympanic membrane. It is a very delicate area of the ear, so just being careful. Now I want you to keep in mind, definitely do not place a Q-tip inside of your ear. So if you're wanting to clean externally, you could do something like place a tissue or a paper towel over your finger and then just kind of gently remove any water externally, but definitely don't put anything in your ear. And try to avoid the use of any internal earbuds. Honestly, I would really try to avoid headphones in general for the next 2 weeks until the course of your drops is over, just to allow your ear time to heal. Okay? So at this point, I think your reassessment is complete. Let me go ahead and just finish up some documentation here. So I will let Dr. Swine know we did a repeat of 128 Hz tuning fork test, which is what he requested. I also did a whisper test, and then we did a secondary test with the air. All right. Now you said you're still feeling a little bit of increased pressure on that side, so right side pressure is still present. Okay. Any pain with that, or is it just kind of overall discomfort?
It's just discomfort.
Just discomfort. Okay.
It feels full.
Okay. All right. So I will go ahead and make a note of that. So I think what I want to do, Cami, is have you continue with your 2-week course. Once the next 14 days are over and you've completed your ear drops, I want you to come back in so we can repeat the series of tests. Really interested to see if that decrease in pressure is gone. If it's not, I might want to refer you to neurology, see if we can do a bit more of extensive testing.
All right,
Okay?
sounds good.
All right.
Thank you.
Thank you, Cami. I appreciate you for coming in to follow up, and I hope you get home safely.
Of course.